today as we remember a great scientist, a great leader, and someone with such a high public conscience. I'm very glad that we're doing this awareness and prevention drive as we remember the most honorable late past President Dr. Abdul Kalam. And as we, were standing in silence and remembering him, I remember the many occasions on which he interacted with us. He played a significant role in launching our Cancer Institute. He launched the Apollo DRDO program and literally, inspired the doctors to do more in the form of research. There have been many interactions with him, and I think that in his memory and with respect to him, we should continue to focus on what we can do to bring healthcare within the reach of people and to enhance science and research so that we have new cures. Now, why WHO declared hepatitis as one of the days like AIDS is it's a little known fact that there are 400 million people suffering from some form of hepatitis. And hepatitis A, B, C, D, E, 5 different classifications of hepatitis. So it is widespread, it is complex, and it is widely differing. So as doctor was very clearly saying, and I'm very happy to have in our midst today, Dr. K.S. Somashekar Rao, the gastroenterologist, Dr. Naveen Polavarapu, our hepatologist and gastroenterologist. He also specializes in liver transplant. 2 very gifted liver transplant surgeons we have with us today, Dr. Manish as well as Dr. Anurag Sharma. And also, because this is such a widespread disease and to lay focus on this, we are especially happy to welcome in our midst today a young man with an illustrious family background who is not only a good friend but known to the entire community, Mr. Nandamuri Kalyan Ram. Thank you for being with us today. It is very important for public to understand that of these various hepatitis, the causative factors are a few and they should be careful about it. Number 1 is clearly unclean water and unclean food. Abuse of alcohol, therefore, it damages the liver, and then which causes cirrhosis. It's not one of the hepatitis aspects of it, but also the spread by sharing, whether it's a toothbrush or other articles of somebody already suffering from B and C, like any virus that can spread also. So personal hygiene, water and clean food are important causative factors. But again, in today's world where public are more educated and aware, the good factor is that so many more facilities are available. So if detected early, hepatitis A and B, as many people know, you can take a vaccine and have prevention. So many corporates, number of our hospital employees have all got the vaccine. So individuals who have not been vaccinated, my request is to please, if you are in a high risk area or even if you want to be careful, please take the vaccination. As Dr. Manish rightly observed, hepatitis C, there's a recent very good drug which can completely, it cannot prevent it, but if you're suffering from hepatitis C, we have the medication available, it will completely reverse it. And finally, any of these viruses, if you're suffering, if you're in the end stage, liver transplant is available and the results are very good. Since we're sitting right here in this area, I asked our team, why are you having the conference here? We have so many auditoriums. And they said, no ma'am, it's important for people to understand the latest technology that we have available here in this department. So the endoscopic ultrasound is a very good new technology that we are, not only do we have the latest machine, but we have 2 talented, well-trained clinicians who are capable of using it with minimal negative impact for the patient. It's pain-free, it's very easy to do. We're also doing tremendous, good number of internal drainages, which is a non-surgical treatment technique in early stage if it's detected. So early signs, when you come into the screening department, find out that you have a sign, most patients, almost 80% of them, can be cured in a non-surgical manner and sometimes even more So we're hoping that the ratio of patients who come in early and increases, and that's what this screening program is all about. The screening is from the 27th of July, which already started yesterday. It goes on to the 1st. Screening program is happening here in the medical colleges as well as in multiple camps which they've conducted in Telangana. As was rightly observed, the incident we are seeing in AP and Telangana is higher than the rest of the country, and therefore patients in this area and individuals in this area, please be careful and please find any problems that you have early. We also have a very good hepatitis vaccination program, and therefore corporates or other groups, even Mahila Sabhas, Sangams, Marathi Association, the Kerala Association, please join together as groups and spread awareness and get yourself the vaccination, including the press. I invite you to work towards prevention. I would also end by saying, in this area, as in every other area, Apollo will work with a multi-pronged approach, which is bring in the best and the latest technology, ensure that we have the best doctors and paramedic staff, our technicians, our nurses, our team is over here, create a greater awareness in public. So please go to our website, look at our SMSs or our, the information that we're spreading, come in early for screening, work on prevention, either through safe techniques as well as through the vaccinations. And finally, if you do need the treatment, we will ensure that the best technology anywhere in the world is available for you. With this, I will once again congratulate our doctors and our medical team for the tremendous work that you're doing in the most complex of patients. A 4-year-old child to have a liver transplant is not an easy thing, and by God's grace and with your skills, she's doing well. I would also like to add that the ICU that we have here is one of the few in the country with a positive pressure. So the chances of infection are very, very low. Here you don't have an open hall. Every room is individual. So not only there's no risk of infection from other patients, but because of the positive pressure and the HEPA filters, we ensure that it's a virus-free environment. This is very important because patients who are very sick are already immunocompromised or are weak in their condition. They cannot withstand another onslaught. So that's why we've created this superb infection-free environment, and that's also contributing to the outstanding results that we're having in liver transplant. I wish all patients who are here and not a speedy recovery, a good and a healthy life, and some good partnerships in this area with WHO, with the government towards screening and prevention of hepatitis. Thank you all very much for being here.